Hello and thanks for watching. I'm John Kwock, your friendly department simulation education champion. You're watching the first in a series of short videos intended to remind you of what best practices are in simulation education, and hopefully become a better, more effective sim educator in the process. In the future, we'll develop more video shorts that will help you grow. Bite-sized faculty development, if you will. Yum! For now, since many of you took the sim instructor course more than just a few years ago, we are reviewing the basics. Today, we start with one of the most important of these foundational concepts, learning objectives. So fittingly, we'll start by reviewing our learning objectives for today. In a second, you'll understand why this step is so important. So pay attention. By the end of this video, I want you to be able to 1. Describe why learning objectives are so critical to effective teaching and curriculum design. 2. Identify where in the curriculum design process learning objectives fit. First thing. 3. List 3 components of a good learning objective, including it being measurable, precisely defined, and appropriate for learner level. 4. Explain how Bloom's taxonomy and action verbs relate to learning objectives. 5. Identify learning objectives that are not optimally written. And 6. Create or define your own learning objectives in your department's sim curriculum. On with the show. So you might be asking yourself, why, John, why? Why are learning objectives so important that you're kicking this series off with them instead of, say, simulator death? The best learning is done by terrifying your learner. Well, we're starting here because every now and then we need to remind ourselves that while simulation is a forward-thinking technology-enhanced teaching modality grounded in our best understanding of learning, memory, and cognition, optimized to make what we teach sticky, what we engage in still boils down to good old-fashioned teaching and educating. And effective teaching depends on teachers knowing and defining what they want their learners to walk away with. Are we running our simulation to encourage new behaviors, adopt new attitudes, teach skills, impart knowledge? You can think of simulation curriculum design as going on a road trip. First, you must decide on where you're going, your travel objectives, if you will. This is an important first step, because from here, you can figure out how you'll know you've arrived at your destination when you get there, map out a route, and once you have a route, you'll be able to determine whether you're getting lost along the way. So learning objectives, 1, tell us where we want our learners to be by the end of our session. 2, tell us what we want that to look like. 3, because of points 1 and 2, it gives us an endpoint we can intentionally design toward as we develop our session. And 4, provides us a way to gauge whether our educational intervention is staying on track or going off the rails. The last thing we should point out is that since well-written learning objectives make outcomes defined and therefore measurable, it, 1, gives us a framework we can use to quantify the success of our learning interventions. Are our learners learning what we think we're teaching them? And 2, since we can measure that, we can use this data to produce scholarly output and engage with the greater education community via publication of our work. And this is why you have got to start with learning objectives and then design your curriculum from there. You might insert this into your water cooler conversations by referring to it as backward design. The advocates of backward design say it imparts every decision about curriculum structure and content a measure of intentionality it would otherwise lack, leading to tighter, more cohesive courses from their inception. So, when it comes to the question of which came first, the chicken or the egg, the answer is neither. The learning objective came first. The creator shall put into existence a feathered animal that can be raised as either pet or food. So hopefully by now you've picked up on the fact that we really want you to embrace the importance of these humble things, these learning objectives. Here we'll transition then to talking about how you craft a good set of learning objectives. The first point to make, and it must be made, is teaching objectives are not learning objectives. Often teaching objectives look like learning objectives, so they're mistaken for them. It's okay if you've done this before. It happens all the time. And fine, maybe this isn't a great example because Clark Kent is Superman, but you get the idea. Here, take this example of a teaching objective masquerading as a learning objective. Discuss plural effusions. Okay, great. Talk about and discuss plural effusions, but what do you want your learners to walk away from that discussion with? The answer to that question is your learning objective. In this example, the learning objective might be, learners will be able to interpret Light's criteria to determine if a plural effusion is exudative or transidative. So what are the differences there that took that from a teaching objective and made it a learning objective? For starters, and in speaking in broad strokes, Learning objectives need to describe in precise terms the learner-level appropriate behaviors, attitudes, skills, or knowledge you want students to walk away from your scenario with. Babies should not be expected to dunk over a 7-foot center, and Michael Jordan should already know how to dribble in a straight line. Learning objectives also need to be specific, observable, and measurable. You've got to be able to know it when you see it. This is an important yet underappreciated aspect of learning objectives. Learners will understand aortic stenosis. That sounds good, but how are we going to identify and measure understanding there, Ned? How about this instead? Learners will be able to explain the hemodynamic effects of aortic stenosis as it pertains to general and regional anesthesia. Well, oakley dokley. That is an improvement, since we've now defined understanding as the ability to explain aortic stenosis in the context of providing anesthesia. In this particular example, the observable part of the learning objective might be the resident's discussion of anesthetic induction in a patient with severe aortic stenosis during the debriefing. And this brings us to action verbs. Every learning objective should have an action verb that describes what you will use to identify fulfillment of that learning objective. It's what you will observe from the control booth or in the debriefing to know that the learning objective can be checked off. For example, students will critique. Students will identify. Students will list. Students will explain. Critique, identify, list. These all describe a behavior or action that any observer would be able to see and know the learning objective is satisfied. It's at this point we usually point out the relationship between Bloom's taxonomy and action verbs, which coincidentally is where most people's eyes glaze over and they start wondering what the Game of Thrones prequels will be like. So just remember this point about Bloom's taxonomy as it is described at the Sim instructor course. Bloom's taxonomy takes increasingly complex cognitive skills and abilities and puts them into 6 categories of higher order thinking. The relationship between the taxonomy and action verbs should be such that the action verb is appropriate for the cognitive complexity of your learner. A brand new second-year medical student might only be expected to list the signs and symptoms of myocardial infarction, whereas a third-year medicine resident should be able to formulate a treatment plan for someone having any acute coronary syndrome event. Your job is to identify where you want your learners to be on Bloom's hierarchy by the end of your session and choose an appropriate action verb to plug into your learning objective and go from there. Let's finish now by taking a look at 3 examples of learning objectives and critiquing them. Feel free to critique along with me. First up, good communication with surgeon. I love good communication with the surgeon, but hopefully you guys have already identified the issue. What is good communication? How are we going to objectively identify when good communication with the surgeon happened? Let's revise it. Demonstrate good communication with OR staff as exemplified by closed-loop communication, summarizing, repeat back, asking clarifying questions when needed, and utilizing nonverbal cues like eye contact and head nodding. In this revised learning objective, we have an action verb, demonstrate, and criteria we'll use to define good communication. Much better. Round 2. Be familiar with sterile technique. It's safe to say you can replace sterile technique with any medicine-related content, and we've seen it. This one comes up all the time. But again, we have the phrase, be familiar with, which we can admit sounds a lot like a good action verb. But if you think about it, it doesn't help us or the learner identify what they're supposed to be taking away from the scenario about sterile technique. How about this? Demonstrate sterile technique during simulated placement of a central line on a mannequin. Here, we are making it clear we expect our learner to physically demonstrate sterile technique, and it is something that's easily identified from the control booth and can be tracked with something like a checklist of expected actions. Okay, last one. Learners will be able to evaluate a standardized patient to determine whether they have capacity to provide informed consent or a power of attorney should be sought. Trick question. This is actually a pretty decent learning objective, as it contains an action verb, evaluate and determine, that are observable and usable as metrics of whether or not the learner satisfied this learning objective. So, finally, since we've blown through a review of an important topic, let's review the most salient points to take from today's briefing. 1. Learning objectives should be the starting point of building your scenario. It gives you direction, purpose, and an end result to intentionally design toward. 2. Learning objectives should be specific, observable, and measurable. This has important implications for quality assurance and improvement programs, judging the success or failure of your educational interventions, and even a scenario's suitability for use in med-ed research. 3. Learning objectives should be appropriate for the learner level your scenario is intended for. This is where Bloom's taxonomy and action verbs are considered. 4. And finally, learning objectives should not be underappreciated. It is the chicken and the egg. They are integral to building an education ecological system that is cohesive, effective, focused, and better for both learners and instructors. Please give them the attention they're due, and we'll see you for another round of sim education tidbits in the future. Thanks for listening.